gingivalis and Rich Darveau back about a dozen years ago as the keystone pathogen. And they pioneered the keystone pathogen hypothesis that basically says that P. gingivalis is the big boss bacteria that everybody else falls in line for and is driving this many of the diseases. So, you know, there's a convention every 2 years. There's one coming up this year. I'm actually, you know, I need to get it on my calendar, but there's a convention every couple of years of several hundred people that do nothing else for a living but study P. gingivalis. It's pretty mind-boggling. And since I think 1950, there have been over 100,000 articles written on PG. So what you've got is professionals being inundated, and yet many professionals just don't have the time to read this. Simultaneously, the general public is getting condensed or simplistic versions of messages that what's going on in the mouth, you know, can affect their brain health, their heart health, cancer, etc. This magazine, The New Scientist, back in 2019, devoted an entire magazine to P. gingivalis. And the lay people literature is being bombarded, which means that conditions are right. Patients now are, you know, when I was first in practice in the 80s and 90s, it was you got to carry your gums or you're going to lose your teeth. We didn't really discuss with patients that, you know, their whole body health was at stake too, because we didn't really have the evidence or the knowledge to do it. Now patients are getting bombarded with this. They're asking their practitioners. They're ready to, you know, have this preached to them. They're ready for therapies. They understand that, you know, what's going on in their mouth can affect their longevity and their quality of life. Okay, we know over 50% of people over age 30 have some form of periodontal disease. At my age, that number rises to 70 and even some statistics say 83% of individuals over age 60 have high quantities of P. gingivalis in their saliva. And we can simply test. There's many different salivary diagnostic companies out there. I've been working in the past with Oral DNA and Bristle Health and Direct Diagnostics, and now, of course, Viome, that provide deep insight from the oral microbiome, including presence of P. gingivalis. What we've got here is just a partial list that's growing on a daily basis of systemic diseases that have been positively correlated to P. gingivalis. Pretty mind-boggling. This is a who's who, what's what of systemic disease. Now, two theories have been promoted in the past. Number one, as I mentioned before, direct bacterial spread, leaving the mouth, entering these systemic organs. But the second theory is that the orally located PG infection is causing systemic disease from afar. This extracellular mechanism fits the existing data better. To really understand what the extracellular mechanism is, we need to know the word gingipains. Gingipains is a family of proteases. They're enzymes that break down proteins that are secreted by the organism P. gingivalis. And the body's immune response causes a host response in various organs. P. gingivalis has grown to thrive in its ideal environment, which is the subgingival tissues. Well, it loves it there because it's an anaerobic bacteria thriving in low oxygen areas. P. gingivalis would not be a happy bug to live in the brain. because the brain has the highest oxygen tension in the body. At the same time, mammals have a biologic barrier, the blood brain barrier, which can prevent the pathway of most common bacterial organisms into the brain and nervous tissue. So P. naturalis is actually unable to cross